السلام عليكم ورحمة الله. أهلا بكم أعزائي الطلبة بأولى مختبرات الكورس الثاني or second semester. In this lab we're talking about vital signs. Vital signs very important, so you should take care about this or these laboratories. Vital signs is regarded as the principle of each diagnosis, okay, and it's include for science or for recorded blood pressure, pulse rate, respiratory rate, and body temperature. Almost every patient in the future we may try to diagnose, you should notice these vital signs. So the normal blood pressure is two-part, systolic and diastolic. Systole in the normal range 100 to 140 millimeter mercury, and diastole the low. السيستول يعتبرونه الهاي واللو هو الدايستول. diastole 60 to 90 millimeter mercury. Sure, this is also called the gold range, but there is range plus minus. The gold range is 120 in systole and 80 in diastole. But there is wide range among all peoples. Pulse rate 60 to 100 beats per minute, normal, and respiratory rate 16 to 20 breaths per minute, and body temperatures is between 36.6 to 37.2 centigrade. So we're talking now about the first one of vital signs, which is arterial blood pressure. Blood pressure means force exerted by the blood against any unit area of the blood of the vessel wall. It measured in millimeter of mercury and constitutes one of the principal vital signs, and is recorded as systolic pressure on diastolic pressure. إذن هو البريشر المسلط على الوالز of arteries, and is recorded by millimeter mercury. Systolic pressure, which is the high degree, diastolic pressure low degree. So from high to low, systole on diastole. So systolic pressure, the highest arterial pressure during each cardiac cycle. It measured after the heart contracts and blood is ejected into the arterial system. So after contraction of the heart, the blood pushed through the arteries to all body. Here we can record the first beat after contraction of the heart. النورمال range when we measured by السفيجمومانوميتر، الابريتس اللي نقيس بيه البلد بريشر نسميه سفيجمومانوميتر. بالريكوردد بالسفيجمومانوميتر راح نشوف النورمال رينج للسيستوليك هو 100 to 140 ملم ميركوري. هذا هو الرينج ضمن النورمال بيرسون. الدايستolic pressure اللي هو lowest arterial pressure during each cardiac cycle after it measured when the heart is relaxed. It is the period of time when the heart fills with the blood after systole or after contraction. Chamber valve are open in this period. So diastolic pressure is occur during relax, after contraction, after complete the contraction of the heart, after the pushing of blood to all arteries in the body. The blood will be returned to the heart, and then the heart will be again filled with the blood. أو نقدر نعتبره هو ending of contraction. ending point of contraction اللي نسميه احنا lowest arterial pressure. النورمال رينج هو 60 to 90 ملم mercury. after recorded بالسفنجومانومتر also. I picture compare the systolic and diastolic. Now diastolic when the heart relaxed and filled with blood, تلاحظون entrance of blood from arteries to the chambers of the heart, atrium and to ventricles. Now the valves تنفتح فيدخل the blood to the ventricles, right and left. While during contraction of the heart, the blood will be pushed out of the heart. So, to the aorta, the all part, the pulmonary to the lung, non-aorta to the all other parts of body. Now during systole, during contraction of the heart, during let out of the blood outside of the heart, while in diastole there is relax, there is falling with the blood and entrance of blood to the heart. then هي الحالة هنا تكون opposite to each other. term pulse pressure. Pulse pressure. Pulse pressure is difference between systole and diastole pressure. Normal range was 30 to 60 millimeter mercury. While term mean arterial pressure was meaning average of arterial pressure with respect to time. In our range or average of arterial pressure بالنسبة للtime, respected to the time. Note in the US, the optimal blood pressure, or sometimes called gold standard blood pressure, هو systole 100 or less than, little less than 120 millimeter mercury, and diastole less than 80 millimeter mercury. لكن هو هذا المين, exactly it's in the mean of systole and diastole. Well, the range يكون more wide. Level above 120 but below 140 millimeter mercury in systole pressure, or above 80 but below 95 in diastolic pressure is referred to as pre-hypertensive. يعني هو ده تلاحظون انتوا السيستول هو more 120 but below 140. هنعرف من ضمن النورمال رينج ال 140 هو the highest point for systole. فلما يكون هو السيستول between these two numbers نقدر نسميه احنا pre-hypertensive. طبعا بالنسبة للدايستول أيضا between ال 80 اللي هو الجولد or the standard diastole point but below 95 اللي يعتبر the highest diastole within normal range, the high diastole point. فلما يكون between these two numbers نسميه أيضا pre-hypertensive, بعد ما صار عندنا hypertension. لكن أكو تمهيد إليه, يعني take care of yourself. Note other note in the mirroring abandoned earlier US practice, nurse students continue to be taught that their patients' reading should be considered normal if the range 140. إن نعتبر هذا ضمن النورمال رينج, ما نقدر نعتبر إحنا hypertensive حتى وإن كان يطلق عليه term pre-hypertensive, لكن نقدر نقول هو normal خاصة بالأشخاص اللي يكونون aged normally إنه يكون عندهم الدايستول high. So mean arterial pressure equal to diastolic pressure plus 1/3 of pulse pressure. So pulse pressure احنا قلنا difference systole and diastole. بمعنى systole minus diastole. راح يكون المين arterial pressure هو diastole pressure plus third of pulse pressure. Also, it's recorded by cardiac output multiply or times peripheral resistance. Then each equation is true for mean arterial pressure. Blood pressure is affected by conditions that affect their either or both these factors. So with these factors, cardiac output while peripheral resistance. Cardiac output مثل السيستول البريشر applied against the artery of body while peripheral مثل resistance of the wall of arteries against the blood or against the pressure of blood. واضح؟ مثل عندي contraction راح يصير عندي pressure وين يسلط على ال wall of the arteries. بالمقابل أنا عندي resistance of the arterial wall against this pressure. The two factors can affect on the result of blood pressure. This picture explains the symptoms of high blood pressure. اطلع عليها شباب لأن هي تفيدكم. هذه symptoms نلاحظها. Not all these symptoms may be occur if the person hypertensive, but there's degrees of hypertensive can be occur. There's defect in the brain with their details and occurs in the blood sugar, either hypertensive combined by retina, defect in the retina of the eye, so be hypertensive either of the heart and the kidney. All these organs may be affected if the person is hypertensive and with degree of hypertension stage. While low blood pressure نسميه hypotensive or hypotension maybe increase the risk of what? Risk of reduce the blood flow to the brain and vital organs. So a low amount of blood pressure, dizziness or fainting, lack of concentration, blurred vision, fatigue, cold, and clammy skin, and rapid shallow breathing. All these symptoms may be developed if the person in hypotension in decreased blood pressure. إلى هنا أعزائي الطلبة ينتهي البارت 1 of blood pressure. مع السلامة.